Let us now learn about intercostal vessels. First, let's see intercostal arteries. Later, we'll see intercostal veins. Intercostal arteries. Thoracic wall has rich blood supply. It is provided by posterior intercostal arteries, anterior intercostal arteries. Each intercostal space has one posterior intercostal artery and two anterior intercostal arteries. You can see here, in each intercostal space, there is one posterior intercostal artery and two anterior intercostal arteries. Posterior intercostal arteries. Each intercostal space has one posterior intercostal artery. There are 11 pairs of posterior intercostal arteries. Origin of posterior intercostal arteries. First, second posterior intercostal arteries arise from superior intercostal artery. Superior intercostal artery is a branch of costocervical trunk. Costocervical trunk is a branch of subclavian artery. Subclavian artery gives costocervical trunk. Costocervical trunk gives superior intercostal artery. Superior intercostal artery gives first, second posterior intercostal arteries. Remember in this way, first, second posterior intercostal arteries. They are superior ones. They arise from superior intercostal artery. Remaining 3 to 11 posterior intercostal arteries directly arise from descending thoracic aorta. You can see here 3 to 11 posterior intercostal arteries are directly arising from descending thoracic aorta. Subclavian artery, it gives costocervical trunk. Costocervical trunk gives superior intercostal artery. Superior intercostal artery gives first, second posterior intercostal arteries. 3 to 11 posterior intercostal arteries arise directly from descending thoracic aorta. Right posterior intercostal artery is longer than left posterior intercostal artery. You can see here, right posterior intercostal artery is longer than left posterior intercostal artery because the descending thoracic aorta is present on left side in front of the vertebral column. You can see here, the descending thoracic aorta is not present exactly in the center. It is present slightly towards the left side in front of the vertebral body. Hence, the right posterior intercostal artery is longer than left posterior intercostal artery. Right posterior intercostal artery lies behind right sympathetic chain, azygos vein, thoracic duct, and esophagus. You can see here, this is right posterior intercostal artery. It lies behind right sympathetic chain, azygos vein, thoracic duct, and esophagus. Right posterior intercostal artery lies in front of anterior aspect of the vertebral body. Right posterior intercostal artery lies in front of anterior aspect of the vertebral body. Left posterior intercostal artery. It lies behind left sympathetic chain and hemiazygos vein. You can see here, this is left posterior intercostal artery. It lies behind left sympathetic chain and hemiazygos vein. It lies in front of side of the vertebral body. Right posterior intercostal artery lies in front of anterior aspect of the vertebral body. Left posterior intercostal artery lies in front of side of the vertebral body. Branches of posterior intercostal artery. Posterior intercostal artery gives dorsal branch, collateral branch, muscular branches, lateral cutaneous branch, mammary branches, right bronchial artery. First, let's see dorsal branch. Dorsal branch supplies spinal cord, vertebra, muscles and skin of the back. You can see the dorsal branch. It is present near the vertebra, so it supplies the vertebra. It supplies the spinal cord that is present in vertebral canal, and it also supplies the muscles and skin of the back. Collateral branch. It arises near the angle of the rib, passes forwards along the upper border of the rib below, and ends by anastomosing with the lower anterior intercostal artery. You can see this is the angle of the rib. Collateral branch arises near the angle of the rib. Collateral branch of the posterior intercostal artery runs along upper border of the rib below, and it ends by anastomosing with lower anterior intercostal artery. Each intercostal space has two anterior intercostal arteries, upper anterior intercostal artery, lower anterior intercostal artery. Collateral branch ends by anastomosing with the lower anterior intercostal artery. Muscular branches. Muscular branches, they supply intercostal muscles, pectoral muscles, and serratus anterior. Lateral cutaneous branch of the posterior intercostal artery accompanies the lateral cutaneous branch of the intercostal nerve. Mammary branches, they arise from second, third, fourth posterior intercostal arteries. They supply breast or mammary gland. Right bronchial artery. It arises from right third posterior intercostal artery. Posterior intercostal artery within the costal groove lies below intercostal vein and lies above intercostal nerve. Van structures from above to below. Intercostal vein, intercostal artery, intercostal nerve. Posterior intercostal artery lies below intercostal vein and it lies above intercostal nerve. The neurovascular bundle lies between internal intercostal muscle and intercostalis intimus. This is external intercostal muscle. This is internal intercostal muscle. This is intercostalis intimus. Neurovascular bundle is present between internal intercostal muscle and intercostalis intimus. Anterior intercostal arteries. Each intercostal space has two anterior intercostal arteries. Anterior intercostal arteries are present only in upper 9 intercostal spaces. Total there are 11 intercostal spaces, but the anterior intercostal arteries are present only in upper 9 intercostal spaces. Anterior intercostal arteries in upper 6 intercostal spaces arise from internal thoracic artery. Anterior intercostal arteries in 7th, 8th, 9th intercostal spaces arise from musculophrenic artery. You can see here anterior intercostal arteries in 1st, 2nd, 3rd, 4th, 5th, 6th. Upper 6 intercostal spaces arise from internal thoracic artery. Anterior intercostal arteries in 7th, 8th, 9th intercostal spaces arise from musculophrenic artery. Internal thoracic artery, it is a branch of subclavian artery. Musculophrenic artery is a terminal branch of internal thoracic artery. Intercostal veins. The number of intercostal veins corresponds to the number of intercostal arteries. Each intercostal space has two anterior intercostal veins and one posterior intercostal vein. Anterior intercostal veins. They correspond to anterior intercostal arteries. Anterior intercostal veins are present only in upper 9 intercostal spaces. Anterior intercostal veins in upper 6 spaces drain into internal thoracic vein. Anterior intercostal veins in 7th, 8th, 9th intercostal spaces drain into musculophrenic vein. Next, let's see posterior intercostal veins. Posterior intercostal veins. Each space contains only one posterior intercostal vein. Termination of posterior intercostal veins. It differs on right and left side. First right posterior intercostal vein drains into right brachiocephalic vein. First left posterior intercostal vein drains into left brachiocephalic vein. 5 to 11 right posterior intercostal veins drain into azygos vein. 5 to 8 left posterior intercostal veins drain into accessory hemiazygos vein. 9, 10, 11 left posterior intercostal vein drains into hemiazygos vein. Accessory hemiazygos vein and hemiazygos vein in turn drain into azygos vein. Second, third, fourth right posterior intercostal veins drain into right superior intercostal vein. Right superior intercostal vein drains into azygos vein. Second, third, fourth left posterior intercostal veins drain into left superior intercostal vein, which drains into left brachiocephalic vein. First right posterior intercostal vein into right brachiocephalic vein. First left posterior intercostal vein into left brachiocephalic vein. Second, third, fourth right posterior intercostal veins drain into right superior intercostal vein, which drains into azygos vein. 5 to 11 posterior intercostal veins on right side drains into azygos vein. Second, third, fourth left posterior intercostal veins drain into left superior intercostal vein, which drains into left brachiocephalic vein. 5 to 8 left posterior intercostal veins drain into accessory hemiazygos vein. 9, 10, 11 left posterior intercostal veins drain into hemiazygos vein.